Almost on.
Okay.
All right. Welcome, Dr. Rita Stanley. We are so glad that you are here with us this afternoon. If you will just kind of tell us a little bit about who you are. I know you, but I don't know that all the people that hang out with me know who you are, and know there's such a phenomenal African-American woman who is doing great things in the world of medicine.
Oh, well, thank you so much, Michelle, for having me on. I am a Kansas City girl. So I grew up in the 3rd district of Kansas City that's having a lot of, during this pandemic, lots of troubles. But I grew up in a household where my dad was a doctor. His father was a doctor. So, part of that is just a legacy for me of providing care to the community. But I grew up there, went to school there, went to St. Louis University Medical School, went to Houston, University of Texas, did my residency, and I have been back in the Kansas City area since about '89. So my training is in internal medicine. So I'm an internist, board certified for over 35 years. I can't believe it when I say that. The first 20, I was like, wow. The first 20 of those 35 plus years were traditional medicine. So like your primary care physician. So I took care of your high blood pressure, your diabetes, all of that sort of thing. And then the latter part of the 35 years, the last 15 years or so, I have done something called functional medicine, which is more prevention. So I learned after 20 years that what I was doing did help people. It relieved symptoms, but it never really got to the root. Why do I have diabetes? Why do I have high blood pressure? And so now I have the joy of digging deep, looking for core imbalances, root causes of every known disease. And I'm able to approach people that way so that they're not dependent on medication necessarily or on less medication. And I also help people to prevent getting sick. So they never have to go down the route of getting a diagnosis and being on a lot of medicines. So that's me in a nutshell.
Do you see that people are a little leery of non-traditional medicine?
Okay, 2 answers to that. No, people are more and more open to non-traditional. The only thing that keeps people from moving further into it is it's not covered by their insurance. Right. Insurance companies pay for us to be sick. They do not pay for us to be well, even though they use the terms prevention. We do a lot of early detection, in traditional medicine. So you got your PAP to look for early stages of cancer. You get your mammogram to look for early stages of breast cancer. So the only thing I think that keeps people from jumping in both feet with functional medicine, integrative medicine, is getting their minds around the fact that they have to invest in it.
Okay.
Because insurance doesn't cover it.
Okay. And so do you see that being geared towards African Americans? Because a lot of us, at the end of the day, depend on insurance for a lot of our coverage, and or don't seek medical help at all.
Okay. So Michelle, we're gonna be real on here?
Yes.
Okay, let's keep it real.
I don't know how to be any other way.
Let's keep it real. So, my existing 15-year functional medicine practice, I would say, is probably about 75% white. Okay. And I know that the only reason that's the case is because of mindset. So, every day that I practice functional medicine, I am teaching and informing so that everybody, including African Americans, understand that there are only certain things that you're going to get in a traditional medical practice, and that otherwise you just have to reallocate some finances, because at the end of the day, I don't know a person who doesn't want to get better with fewer medicines, and are willing to do the work. So once I've taught and, given people the benefits of investing in their wellness, then, I see more and more of us, more and more African Americans coming over to that. And I'm going to tell you, I know we're going to get in this discussion, The only thing that's going to keep us from being another huge statistic like we are now in this pandemic, the only thing that's going to change that around from a medical, physical standpoint is us really understanding what the root cause is of all these diseases that cause us to die more from COVID. And we'll talk more about that, but the only way you're going to really get to the root cause of insulin, of diabetes, high blood pressure, heart disease is a functional medicine pathway. Looking and measuring for underlying imbalances before they cause full-blown disease. That's not going to happen in a traditional medicine office.
So explain what functional medicine is, because I think sometimes we have terminology and we get caught up on that. And so what is actually functional medicine?
Sure. And it is what the word, if you think about function or functional, how something is actually functioning, what's making it function in a certain way. So in traditional medicine, we are trained to ask what is that disease? What is that? So we're trained to diagnose and to medicate or treat, okay? In functional medicine, our first question is, why? Why is Michelle, why are her blood sugars going up? Why is she getting fat around her midsection? Why is she, so we're looking at a level of biochemistry, genetics, the impact of environment and food. We're looking for the baseline primary reason that your body's not functioning well. And let me put it another way. In traditional medicine, we tend to look at different body systems. We pull them apart. So you have a cardiologist, you have a gastroenterologist, instead of looking at the body as a total system, because that's how we're created. That's how God created us. We're not individual organs. We are a system. And those systems, those different parts of us work together. So it doesn't do any good for me to come at you just looking at part of you. In functional medicine, we're able to look at you as a whole total body system that's interactive and interconnected and unique, even though we all have the same organs and every person, that's God again. He made each of us so unique. But in functional medicine, we're able to measure certain things. So let me tell you real quick, there's only about 5 or 6 underlying imbalances that cause most of the disease that we see, particularly in the African-American community. That's around inflammation. Inflammation is number 1. Hormone imbalance, issues with gut health and the microbiome, problems with detoxification, what's going on with your mitochondria, which are those little organelles in every cell that produce that life-giving energy, ATP. So we know that there are about 5 or 6 underlying, or what we call core clinical imbalances. And here's the thing, Michelle, we can measure all of them. So if you come to me and you say, Dr. Stanley, I don't feel good. I just don't feel good. That's what I started hearing 15 years ago. Something's wrong, Dr. Stanley. I don't feel good. So I did my traditional medicine test and I'd say, Michelle, look, everything's normal. So I realized at some point that I wasn't measuring the right things. You cannot find what you don't look for, what you don't know to look for. So once I retrained in functional medicine, I knew I had to measure the HSCRP, C-reactive protein. I can tell you how inflamed you are. I had to measure all your hormone levels, not just your menopausal levels. I needed to know what's going on in your pituitary, your thyroid, your adrenal. I had to see what your gut health was like. So we're able in functional medicine to measure things. So nobody has to guess. And once we have measured these things, then we can prescribe food, first of all, food as treatment. Very seldom do I give prescriptions because food is 99.9% of the treatment of most given diseases. So functional meaning we get to the functional bottom line. What's not functioning right? Why is it not? What do you need supported? What do I need to help remove to get you functionally at your optimum?
So speaking of food, as we start to look at COVID and we start to look at how right now African Americans are the population that are being taken out by this, how
Mhm.
does food play a role in what we should be doing to combat this? Because you talked about that inflammation was the first thing.
Yeah.
And a lot of the foods that we eat, a lot of the things that we do produce a
Mhm.
lot of inflammation, produce a lot of mucus, produce a lot of the things that they're saying are causes or underlying root issues for COVID. So what should we be doing?
hmm So, way before COVID blew in, most of us were walking around inflamed because of our diet. And that would be things like potatoes and rice and pasta and bread and soda. And those are just kind of
Tell
in,
me.
it's like, what else is there to eat, right? So,
Right.
so, when we have a diet that's predominantly carbohydrate,
Mhm.
that's what really stokes the fire of inflammation.
Okay.
And if that's just been ongoing, for years and years, and you are walking around in an inflamed state, and then you get exposed to something like coronavirus,
Mhm.
which also stokes, it's an inflammatory infection. So at its root, beside it being an infection, it it revs up our inflammatory system. And you
Okay.
hear the word cytokines and that sort of thing. Those are different inflammatory products in the body. So when you're hot and then somebody pours kerosene on it with the COVID infection, then that inflammation, that inflammatory process overwhelms. So we see lungs get filled up with fluid and mucus and people can't breathe. And
Okay.
so, I'm sort of at that point right now where I say to people, okay, this is not a surprise that we're dying more from COVID. This is
Mhm.
just in your face, snatch the cover off. Here's what we've got to do right now to get ourselves through this. And they're talking about second waves and third waves, but I'm convinced by October, November, December, when they're talking about this influenza slash COVID, uh,
Right.
that we could be, Michelle, we could, if we do some things now, we could be much better prepared.
Okay.
And for that, whatever the next wave or whatever the next organism, because if we can cool down that baseline inflammation, then
Okay.
we have a better chance of overcoming and recovering from an insult like COVID.
So what kinds of things? So you said that we shouldn't be eating potatoes and rice
Right.
and those carbs. So what
Mhm.
are the things that we should be taking in at this point?
Sure. So, at this point, and it should always be, whatever our diet, whatever your preference for eating is, the very foundation of it should be green, leafy vegetables, all the rainbow colors of the vegetables. So we're talking about, cabbage and collards and whatever greens you like, and romaine lettuce, and I'm talking about plant-based food,
Okay.
really at the very foundation. It doesn't mean you have to become a vegetarian or a vegan, but that has to be the real focus, the real foundation of what we're eating. Um, Fruit in moderation. We can't just be eating lots of fruit because fruit has its own sugar that can
Right.
cause inflammation. So I tell people 3 servings of fruit a day, preferably berries, not watermelon, not a lot of grapes, not a lot of bananas. Those have a lot of sugar. So if you stick with the berries, strawberry, blueberry, all the different berries, then you're less likely to get overwhelmed with sugar from them. So 8 servings of vegetables, 3 of fruit, and then let's talk about you're talking about putting a fire out, healthy fats.
Okay.
So things like coconut oil, extra virgin olive oil,
Okay.
avocados, whole eggs, meaning please eat the yolk.
Okay. I'm
Okay.
glad you said that.
and and butter if it comes from an organic source or grass-fed beef source. So these healthy fats, we now understand, kind of tamper down the inflammation in our body.
So when we look at healthy fats, we're not talking about Crisco. We're not
No,
talking about canola oil or things of that.
no.
Because I want us to be very specific. Because I think when we talk about fats and we talk about what we're eating, if we, you know, there's always that line in between there. So I want us to be very specific in how we are helping. This is not fried foods. This is not frying stuff to death.
No, no, it's not. This is because the things like margarine, you should never buy margarine ever again. Margarine is hydrogenated. So when I use that word hydrogenated, it just means that they've chemically changed the structure of what could have started out to be good. Like, you know, the vegetable oils, you think, hey, it's a vegetable oil. That's got to be good for me. But by the time they've kind of tampered with it, and just look at the label, you know, if the label has got 8, 10 different words you can't say, and all it is supposed to be oil, a vegetable, then you know that they have tampered with it. So I'm not talking about margarine. I'm not talking about any of the oils that are hard. Well, coconut oil is hard before it comes to room temperature, but the things like coconut oil and extra virgin olive oil, those are plant-based saturated fats.
Okay.
So yeah, avocado oil is a good one as well. Avocado, but again,
grapeseed oil, sunflower oil.
Yes. Yeah, and you just have to. It gets confusing. So, you know, I tell people when it comes to all the different oils, sometimes it's just better to go to a health food store. You may not buy anything there, but just look at the different oils and talk to somebody there. But you are safe with extra virgin olive oil, with coconut oil. Coconut oil you can fry with. Olive oil, we're not supposed to really heat to high temperatures. We've made a mistake of doing that.
Right.
So if you're going to be scrambling eggs or frying something a little harder and hotter, that should be coconut oil or avocado oil. Those are the safest ones. And then we all hear about turmeric.
Right.
Yeah, that's a powerful antioxidant. It can also help with inflammation. And then things like even good organic nuts, if you can get organic nuts, but nuts, unsalted, just raw, are good sources of healthy fats as well.
How do you feel? Go ahead.
Go ahead.
How do you feel? So you said turmeric is good. I know that oregano is a natural antibiotic. So how do you feel about that?
Yeah, no, oregano, we just have to be careful with oregano oil. Some people will start taking it and just start taking it like a daily supplement. I utilize oregano as a therapy. It's therapeutic. Like an antibiotic, you would take a course of it. So I use it more commonly when I have people who have yeast overgrowth. Yeah, and I've measured it some sort of way, particularly on things like food sensitivity testing. They'll give you an antibody amount that's measured based on the candida or the yeast in your body. So when I see people have a lot of yeast, they have the symptoms that go along with it, then I'll give them sort of a course of oregano oil, but it's no more than like 7 days. Yeah, so it's not something I recommend people just stay on day after day after day. Yeah.
So what other supplements, because I know personally, I don't eat as balanced as I probably should. You know, some days are better than others. Some days, you know, it's a lot of cookies and chocolate. But you know, we're if we're being honest,
yeah,
if we are adding foods or changing our diets, what are some things that are going to help us to be more balanced in that? So I'm, you know, should we be looking more at an alkaline kind of, you know, how do we make our system more alkaline? I know that that's been kind of a bug. What are some of the, you know, vitamins?
Sure.
What are you taking?
Well, you know, if you start out with a good foundation diet-wise, lots of plants. Plants tend to be the thing that really cause your body to be alkaline. So if we're eating a really good, I say balanced diet that's plant-based primarily, very little carbs, that all by itself is going to provide an alkaline environment. That's the way our body functions. Best is alkaline. When we get acidic, then things don't function as well, and we kind of open the door to a lot of things, cancer, infection, so on. But I'd say, the foundation is a good diet. But there are a couple of things that I'm adamant about, because I talked about inflammation being part of the reason why we are suffering so much in this pandemic is our baseline inflammation, and then we get insulted with COVID. The second is, way before the pandemic of coronavirus, there is the pandemic or epidemic of vitamin D deficiency, D as in dog deficiency.
Right.
It is rampant, particularly in the African American community. And the research is so available, has been for 10, 12 years, showing the connection between vitamin D deficiency and high blood pressure, heart disease, obesity, diabetes, the same diseases that are causing us to not do well in general, but now we're being slain by this virus because of these underlying conditions: high blood pressure, heart disease, diabetes, obesity. And all of those diseases have been connected with vitamin D deficiency.
Okay.
There is not equivocal. The research is clear. And so and 85% of us, African Americans, are deficient in vitamin D significantly. I was doing a presentation recently and showed a bar graph, and it showed that for women aged 18 to 45, only maybe 1% or less of us has a vitamin D level over 40, and it really should be over 50. So you can assume, ladies and gentlemen, you can assume that if you're not supporting your body with a vitamin D supplement, D as in dog, 3, that you are deficient every day of your life. And it's like this open door. It's an open door to chronic disease, and it's an open door when we have another insult like COVID. And so I am adamant about D3. And it seems so simplistic, but I'm gonna tell you what, if we will get that vitamin D level up, I can tell you this next round, we're gonna see some different stats, and I believe we can do it. So vitamin D3, and it ideally, Michelle, all of us would have that vitamin D level checked by our primary, right? So you'll have a baseline, you'll know the number. But nobody does it routinely. People go to their doctor and say, can I get that vitamin D level done? Well, your insurance might not pay for it. And that's the end of the discussion. And so that's not fair. So I say this, 2 things to people. I'm confident enough, and I've been recommending vitamin D now for 15, 17 years in my functional medicine practice. And I always recommend, but I measure. So everybody that comes to see me gets a baseline. But even if I couldn't measure, I would still give them 5,000 IU, 5,000 IU of vitamin D3 per day. That's a maintenance to me. Now, if you're low, if you start out 10, 12, then you really need more temporarily to get it up and then come down to the 5,000. But I can say this to anybody who's listening to me. If you cannot get access to be tested, if you don't know what your D level is, get on vitamin D3. It's inexpensive. You can go to anywhere and get it. Start on the 5,000. The only people I tell not to is people who are on dialysis, because they tend to already be on D3 under a different name. But anybody else needs it. I'm telling you, if you could look at the biochemistry of vitamin D, you would see that it interrupts and reduces a lot of this pro-inflammatory business that's happening every day in our bodies. And now it's revved up with this infection that's around us. So vitamin D3 is life-saving, life-giving. If I could test everybody and myself, I would do it. But if you can't get tested, please get on it. So a good balanced diet, vitamin D3, and I tell you the second most common deficiency is around magnesium. Magnesium, very important as well.
And how much of that should we be looking at?
People take from 200 milligrams all the way up to 1,000. So I always say start low, go slow, 200 milligrams. And it's so necessary for a lot of things, your cardiovascular health, your having a good bowel movement. It helps you relax. It helps people sleep. But it's so integral at the cellular level to our production of ATP. That's life energy. So, and there's a number of other things I could list, but I would say right now D3, magnesium, and then vitamin C. We hear a lot about vitamin C right now. And it's also an important vitamin. And we really should be on that every day, 1,000 to 2,000. That's kind of low end, but start at 1,000 milligrams a day.
Okay.
And then gradually work up 500 milligrams, maybe every week or two, until you can get up to, if you can get up to 3,000 or even 4,000, that's great. You'll know when you've reached your max because your bowels will get loose. So that's a good measuring stick, but it's hard to get too much of it, and it has a huge impact on immune system as well, and inflammation.
So as we're looking at COVID, what are some things that, as far as you've given us some vitamins and you've told us that, we really got to look at our diet. And I don't want to get too far away from diet, just because I know you said that we don't have to be a vegetarian. I also think that there are some things that we do as we cook. As African Americans, we tend to cook the vitamins out of a lot of our food. We tend to put a whole lot of meat in our food, which kind of, am I right, prevents the effect.
You're talking about the meat part of it?
Yeah.
The way we cook it. Well, here's where we have to remember again the uniqueness of every human being. So I can make general statements, and that's what I've been doing, general statements that are going to benefit most of the population. But then you have individuals who, based on their genetics, their GI tract, do better with just more of a vegetarian vegan diet. They do better. But then you have other human beings who don't do well just with vegetables, no meat. So it's so individual. So I try my best not to kind of just put everybody in the same box. I'll say this: if you're a meat eater, you have to be very careful about the source of your meat. So at this point, well, if you can afford it, just eating mainstream meat out of the case, you're going to get, for instance, with beef, like if you like ground beef or steaks, if you just get the kind of the meat out of the Walmart bin, you're going to be getting the cow, of course, the beef. You're also going to be getting everything that the cow's been fed, and they put antibiotics in the feed and what they've been injected with. So they're injected with bovine growth hormone. So just knowing that, if you can do it, you want to find a cleaner source of your meat. So grass-fed beef, and the same for the products of beef. So I tell particularly African Americans, we don't do well with milk. Really, milk was never for humans. We don't do well with dairy, I'll put it that way. So if you're a cheese eater, you love cheese, you love yogurt, you're going to always want to find the best source of the milk for your cheese, or the best source of the milk for your yogurt. And that would be what they call, organic or grass-fed. And the same for chickens. You're going to want free-range pastured chickens that haven't been, modified with all this stuff. So, some people do better with no meat. But then I see a lot of people that come to see me who have gone that route, and then their B12 levels are low. They've got some zinc deficiency. So it's just, everybody's different. And so what I try to help people do is to find out at a level of measuring whether you really can do well on a diet that doesn't have certain things in it. So, yeah.
That makes sense. So as we look at COVID, I know that you have been doing telehealth. How does that work for, I know that especially in smaller areas or areas that where there's seniors, you're not really wanting them to come into the office, you're really wanting them to call. Kind of tell us a little bit about telehealth, and what have you been seeing with this COVID piece?
Oh yeah, it has just been an eye opener. because I'd never done telemedicine. I started doing it probably about 3 months before the pandemic. But what it allows people to do is to have access, even before pandemic, the COVID pandemic, access, because all the insurance companies realize that, people take off a lot of time to go see their doctors. They don't always need to do that. So Blue Cross Blue Shield, Cigna, a lot of the big companies have just included that telemedicine in their line of benefits. So people can call in. It's like urgent care. In the midst of this pandemic, however, individual doctors' offices have had to quickly get themselves equipped and prepared to do telemedicine visits on their patient group, on their patient population. And so it's a matter of getting the right software and all these sort of things so that they literally are seeing their patients from probably the comfort of their home or wherever they are, but they're able to do some things. You can even get some vital signs via telemedicine.
Oh,
Now,
really?
oh yeah. So, but for the purposes of people, and particularly African Americans in our community, if you don't have any insurance, you may not have a real relationship with somebody, there's still possibility of having access to telemedicine. And that was, I don't know, Diversity Telehealth is Shelley Cooper. I'll just say her name. Shelley, but anyway, she and her husband have a company that has, as part of its services, telemedicine through Teledoc. So okay. I say this to anybody listening, diversitytelehealth.com, and I want to make sure you got that right. Diversitytelehealth.com. And you can go on there, and when you hit that website in the right-hand corner, you'll see something that says enroll in Teledoc. What does that do? It's not free, but they have different levels of packages. So you can do the baseline $11.99 a month, where you have access to somebody that can help you through this, because nobody can get anywhere right now without being concerned about. So what I've discovered, Michelle, is I've seen a lot of people on the telemedicine platform since this pandemic. And, a lot of it's just routine things. Others is a great deal of fear and anxiety, because if you start coughing,
your brain automatically says, I got the Rona.
So, it has really forced me and my colleagues to really stay current on everything, because it's changing every day. So it's been like going back to school, learning about COVID. What does it do? What are the symptoms? And so it allows me to listen, hear them out, kind of reduce their level of stress. Unfortunately, because the testing is not really accessible, we can't just say, here, go get tested. No, ma'am. We can help as much as possible to tell them where their testing sites are, because I'm talking to people in New York, Indiana, Ohio, Kansas, Missouri. So you can imagine the people I was talking to in New York in the epicenter really wound up. But, it's ministry. It really is. Just really kind of calming people down, directing them, helping them get prescriptions that they've just run out of and can't get to their doctor. So, and we're going to see, even after this pandemic, it's going to become a regular way of people getting access. Not the only way, but a regular way of people getting access. And we need that in our community. We can't be sitting in our homes. Oh my God, do I have it? And nobody's guiding, nobody's telling you, oh no, don't worry about this, or let's get you someplace. So yes, ma'am.
As you, because in your other life, you are a pastor's wife, and what are you saying to your parishioners, through this? How are you guiding them with a medical, from a medical lens, but also from a spiritual lens?
Mm-hmm. Yeah. From the very beginning, and I think for a couple of reasons, because early on, before people were even really paying attention to it, I was listening. So I knew that it was kind of coming this way. And so it's not really easier, but having more information maybe than other ministries or other just having that much more information allowed us to kind of shut it down maybe a week, maybe a couple of weeks before everybody else did. So, and just letting our members know what this is that's coming, what does it look like, what you've got to begin doing different now. And the other thing we did, my husband and I just systematically went through the membership. And there were some people we knew would be at great risk if they showed up at church, people
Right.
who were recovering from cancer, people on chemotherapy, people who worked there that were still working in the healthcare system. So we knew we could not put that gumbo together. That would be no. So early on, it was like, no, we can't do this. And fortunately, our bishop, because we're a planted church out of Kansas City, Bishop Steve Al, great man of God, great man of wisdom. He did the work. He really shut it down for us, or reinforced it so that none of us were trying to press out, because you know how we are. It's like what the pastor said, we just.
The doors are open. We got to be there.
So not here. So yeah.
So how do you see integrating back in? So post-COVID, our close down, because we're grounded right now. So once we're ungrounded, how do you see, and how do you think you're going to be able to move back into that? People are ready. I mean, we had some people that showed up on Easter, even though we told them not to.
Yeah. And we just have to be so the leaders, so the influencers, so the people who just help them with that, because I understand that. I miss everybody too. But for us, we're going to follow the science. I'll just say that to you, in the sense that just like what you're hearing on TV, where we're going to be looking at the rates of new infection in our community. We're in Topeka. We'll be watching those numbers and making decisions based on facts, making decisions based on increased testing information. And then even then, there will be several people that will probably just recommend that they don't come for a while even. So I don't see us being back in a space again, everybody. Wow. June, I don't even, that'd just be an arbitrary guess at this point. But we're going to follow the facts and listen, we have the Holy Spirit.
Right.
The Spirit of God.
Right.
He talks every second of every day. So
are we listening?
What'd you say?
I said, but are we listening?
That's the thing. So I know my husband, Pastor Tony Stanley, our bishop, they are going to be checking in constantly so that their flesh doesn't override the wisdom of God.
Right.
Because we've already seen the outcome of that, and it's been devastating. Right. So yeah, it's going to be gradual and kind of phased in based on facts and the voice of God.
So as we look at the facts, we are, again, African Americans are contracting this more than any other population. What are some things that, as we are having conversations with our friends and our family, because one of the things that we're seeing really with the younger population is they don't want to stay at home anymore. People, they don't know, they don't personally know someone who has died from it. So they're just like, well, this is stupid. We've been at home, nothing's happened. It doesn't matter. We can go hang out with our friends. So how should what are the things that we can be saying to our friends and our family to really encourage them to go ahead and ride the tide out?
Yeah, I think we really have to make it so personal, and it may be a little more difficult when they don't really know anybody, but I don't know anybody that doesn't know anybody that doesn't know anybody. And you know what I'm saying? So we have to do it in a way, a couple of things. This is all quite a time of personal responsibility. I guess that's the word I would use, because at the very root of this is the fact that what I do as an individual is not just going to affect me, but it's going to affect everybody around me. So maybe kids, maybe youth don't quite get that, But I still think that they have to understand that their decision to go out and hang out with a bunch of people means that what they're saying is, I don't really care. And you have to be blunt with them. When you go out and do that, what you're saying is, I don't really care what happens to me, and I don't care what I bring back in this house that could affect you, grandma. So, I think we just have to paint this really vivid picture, because that's what's happening. That's what's happening right now in the African American community. You have people who are stepping out, doing their thing, thinking they can come on home. Nobody saw me, I'm good. But then grandma starts coughing, and you're not self-isolating or quarantining in the home, and you're not being tested. And so you're bringing back, and they don't realize that. They don't, unless you've experienced that in your household or in your church, it's hard to get your mind about it, but still it needs to be explained. It has to be explained. The whole issue of taking responsibility for self and for others.
Right.
And I really think that young people, wow, I think it's an opportunity that we have now to allow them to grow up and not figure it out, but allow them to think and make decisions and have them verbalize it to you. Why? Ask them, why should you stay in? Why shouldn't you go out? And see if they get it. See if they can explain it back to you. Well, I shouldn't go out because if I go out and get infected, I could get sick. You can get sick, Mom. Grandma can let them verbalize it and hear themselves. Right. And I just believe that they're smart enough to and can think critically enough that they'll, even though their flesh will be like, I don't want to do this, they'll do it.
As an adult, I don't want to do it, but it's important.
Yeah. Mm-hmm.
So we're going to wrap up here in just a couple of minutes, but I want you to really kind of explain to us, if I was to come to your office, what would that look like for me?
Okay. Sure. So before you even came to my office, you would have had a conversation with me, first of all, and I would have provided you with lab order form and a very detailed health history, so that by the time you come and see me, I've got all your lab, okay? I've got your results, so we're sitting down with your information. But leading up to that, I would explain to you exactly how I'm approaching you, and I would compare it to what your regular doctor does. And it's not difficult because people come to me desperate. They're not just coming saying, oh, Dr. Stanley, I'm just coming checking up. They come to me because they've been every place else and nobody's been able to give them an answer. So when they come to me and I listen to them, and because I've done it and I'm hearing the voice of the Holy Spirit as well, I could almost tell them before they get the lab done, but I explain to them the importance of not guessing what's going on, but let's measure some things that you've never had done before. So it's no convincing because they're coming desperate. They know that what's causing their discomfort has not been identified. Right. And so it's just a matter of them following those instructions, getting that work done, coming in, and boom, there it is, Michelle. I never get somebody where everything looks perfectly normal, not the things I measure. So there's always something. And, my niche that I really love is around hormone imbalance, because that's so rampant as well. And not just menopause, but even things like adrenal fatigue, which is good. You're talking about the office being full when this is over, because adrenal glands bear the brunt of stress. And most people walk around with adrenal fatigue, even on a good day, pre-pandemic. It's going to be crazy in about 3 to 5 months. People are going to be fatigued, can't get up, can't, not recovering, just all manner of things. So I know that's going to be something.
That's kind of what we're seeing right now, because people are up. I mean, you get on Facebook and people are like, oh my God, I was up all night.
Mm-hmm. That's it. So they're stressing. Every time we do that, every time there's something coming at our human body that the body recognizes as a stress, or the brain says to the adrenal glands, spit out the cortisol. I mean, it just goes into this thing and you can't control it. It's just how
Right.
God created us. But pretty soon your adrenal glands like, you need to give me something. I've done all I can do. So it needs to be supported. It needs to be measured and supported. So yes, ma'am. It's just a total body kind of just a redo, and people get what their body needs once we've measured and started supporting, whether it's with hormones or supplements or certainly food. And I never see somebody who doesn't feel better because you're getting to the root of it, not just putting a bandage on.
Right. So so are you taking new patients? And I always ask any doctor this because somebody later on will be like, oh, how do I call her? But if you're not taking new patients, there's no reason to call.
Yeah. Well, I think the easiest way to get me is just by email. So you want me to go ahead and
Sure.
All right. And that's dckcstanley@gmail.com. So
Okay.
if something resonates and you want to move further with me, that's a way to do it. I have a website too, Rita C. Stanley, MD. And then I'm on Facebook. That's my favorite place to be. So you can go on Facebook and friend me or go to my page, Rita Stanley, MD.
And she does go on and she makes wonderful recipes. And she puts some things on there to kind of help you through some big times.
That's exactly right. So I just want to be of help, and I want people to feel empowered. That's the important thing to me. I know we're kind of a statistic right now, and you hear about the disparities, but I'm like, look, okay, that's a fact. But what can you do, or what can I help you do? Things that are actionable, things where you can say, okay, I'm getting that D3, or I'm getting, so that you can begin that process.
Right.
So that come fall, when they start talking about, the blah, 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 and we've got to stay home again, you won't be like, because you'll know your D level is up to 60 to 80, and some of those other things, your inflammation's down, and you can feel more confident that even if you get infected, it's not going to wipe you out. So
right.
Be empowered.
All right. We appreciate you, Dr. Stanley. I'm sure you have more calls to take, but definitely want to thank you and appreciate all that you're doing in our community. I know that right now, doctors and people, medical professionals are definitely under a bit of more stress because there's so much going on in the world and so much happening in our communities. But we appreciate you. We appreciate the fact that you are being led by the Holy Spirit as well as medicine.
Yes.
Any closing thoughts that you have for us?
No, just be encouraged, even in the midst of all this. We'll get through this. When you know better, you'll do better. So I pray that through this, you're learning some things that you'll do differently. And I'm excited about post-corona. Okay, I'm excited that in each of us individually, God is doing a work and He's speaking to you. Please listen, so that we can come out of this totally different, transformed people.
Absolutely. Well, I will be calling you because I have some things that I need to ask you personally that don't have anything to do with the world. But I'll be calling you. But I thank you again. I appreciate your time. Have a great day.
All right. Bye-bye. Thanks so much.